Septic shock, causes and prevention. Septic shock is a severe and potentially fatal condition that occurs when sepsis leads to life-threatening low blood pressure. Sepsis develops when the body has an overwhelming response to infection. Knowing how to recognize and prevent septic shock is vital. The body usually responds to an infection by releasing inflammatory substances into the bloodstream. This regulates the immune system to fight the infection. When the body loses control of this response, it triggers damaging changes to the organs. As a result, they can become dysfunctional or even stop working entirely. This condition is called sepsis. In the United States, there are an estimated 970,000 sepsis-related hospital admissions annually. If a person with sepsis has low blood pressure that does not improve with fluid treatment, their body has gone into septic shock. They will need medications called vasopressors to keep their blood pressure high enough to get blood to their organs. Without this treatment, insufficient blood flow can result in vital organs not getting enough oxygen and beginning to fail. Both sepsis and septic shock can be fatal. A study of hospital admissions in California found that sepsis contributed to 1 in every 2 to 3 deaths. In addition, a 2016 review reported that in cases associated with septic shock, the mortality rate was around 46.5%. Septic shock may also lead to life-altering complications. This can include chronic pain, incorrectly functioning organs, and post-traumatic stress disorder. Causes. The most common cause of sepsis is a bacterial infection. Sepsis can then lead to septic shock. When bacteria find their way into the bloodstream, harmful infections might occur. Bacteria can get into the bloodstream through an opening in the skin, such as a cut or burn. However, some of the most common conditions that can lead to sepsis include pneumonia and infections of the abdominal area, kidneys, and urinary tract. Fungi and other viruses may also lead to sepsis and septic shock. The following groups of people have a higher risk of sepsis: those who are under 1 year and over 65 years of age, people who have a compromised immune system, such as those who have HIV or are receiving chemotherapy, people who are already unwell or have long-term health conditions such as diabetes, lung disease, or kidney failure, individuals with open wounds, injuries, or burns, those with implanted medical devices such as IV catheters or breathing tubes. Symptoms. Symptoms of sepsis may vary from person to person, but early signs and symptoms typically include the following: shortness of breath, fever, shivering or feeling very cold, extreme pain or discomfort, a high heart rate, unexplained confusion or disorientation, sweaty or clammy skin. Additional symptoms may include common signs of infections such as fever, diarrhea, vomiting, or a sore throat, decreased urination frequency, pale or discolored skin, rashes. Prevention. There are a few steps that people can take to reduce the risk of developing sepsis and septic shock. Get regular vaccinations against viral infections that may cause sepsis. Practice good hygiene. Care for and clean any open or gaping wounds. Follow medical advice on managing bacterial infections. Treat fungal and parasitic infections as soon as symptoms appear. Control diabetes if relevant. Avoid smoking. Hand washing tips for people with compromised immunity. People with compromised immune function should take extra care when washing their hands. The following steps can assist in proper hand washing. Remove rings and watches when possible to clean the areas of skin beneath them. Add warm, running water to the skin on the hands and wrists. Lather liquid soap onto the hands, being sure to include the skin between the fingers. Spend 10 to 15 seconds washing the hands. Use a towel to turn off the tap to prevent recontamination. Treatment. Septic shock is a severe illness. People with sepsis and septic shock require hospitalization and immediate treatment. Studies have shown that even minor delays in treating severe sepsis and septic shock may increase the risk of death. Sepsis and septic shock are life-threatening conditions that require urgent medical treatment. Sepsis occurs when substances released to fight infection begin to attack internal tissue and vital organs. Septic shock can develop as a complication of sepsis if a patient's blood pressure drops too low. Septic shock is a critical condition and carries a high mortality rate. Bacterial infections are the most common causes of sepsis. They can originate externally in wounds or as a result of conditions such as pneumonia. Anyone who suspects that they or someone else may have sepsis or have gone into septic shock should seek emergency care. Early diagnosis and treatment are vital to a good outcome.